Yeah.
Number one is tobacco smoking. We've known about this for a long time now. And the proportion of the population that is smoking has sort of dwindled and dwindled and dwindled. And hopefully at some point it will be an even smaller slice or perhaps go away entirely. And looking at the risk factors, you can see why this might be growing. Number one is tobacco smoking. We've known about this for a long time now. And the proportion of the population that is smoking has sort of dwindled and dwindled and dwindled. And hopefully at some point it will be an even smaller slice or perhaps go away entirely. But next we have a lot of things that are environmental. So things that people are doing or exposed to in their day-to-day lives.
Yeah, and we can put this chart up on the screen. As people can see, excess body weight is the second leading risk factor. So that's becoming more and more common. We've done podcasts on obesity in the past, but of note, there's also a good comparison. We'll do this in the future for our fertility and antepartum podcast. We'll have a whole series on fertility, conception, antepartum, the delivery period, and postpartum as well, as that's been a huge part of my practice. Delivered a couple hundred babies, done a lot of fertility treatments, done a lot of care during that period. But anyway, all that said, to say the risk of birth defects, certain types, and also certain types of perinatal outcomes are roughly equal if you look at smoking, moderate amount, and having a significant amount of maternal obesity. So it kind of makes sense. These are two things, not just for cancer, but for other health outcomes that can be very detrimental.
Yeah, I've heard this talked about as like epigenetic imprinting, where you have a mother and a father who all of the cells that will make up their children and then eventually grandchildren are present in that environment, whether that environment's being exposed to tobacco smoke or being exposed to inflammatory cytokines and oxidative stress from obesity. Mm-hmm. You do have a metabolic sort of imprinting on your offspring in that way. So second place, I suppose, in terms of increasing cancer risk is excess body weight, followed by alcohol, followed by ultraviolet radiation, sunlight. And
especially certain types of cancer.
Yeah, tanning beds fall into this too. Tanning beds have an outsized negative effect. And then you have poor diet, infections. These are things like HPV, different viruses, and then physical inactivity. And there's a lot of overlap between the excess body weight, the poor diet, and physical inactivity. That's sort of your triad of obesity.
Yeah. So as you might imagine, and as I can also imagine, a lot of individuals that have cancer early in life tend to have many of these risk factors. Modifying them, just like in hormone optimization, just like for cardiovascular disease, is the most powerful intervention that you can have. More powerful than any medication or supplement is going to be your lifestyle interventions or your pillars of health, diet, exercise, sleep, things that are not very sexy and things that are not going to make big pharma or big supplement very much money.
But big pharma does have, I guess they have pills too, but most people are talking about injections now that they don't make people eat healthy foods, but they make them eat less bad food, which in many cases can be a net positive, but not without risk, of course. So we need 2 more pills to complete the reversal of the health of society. We need a pill that makes people eat healthy foods and a pill that makes people exercise. So you have people eating less. Now you just need the other 2 pills, and then you've sort of solved the problem. Maybe that'll be Neuralink. Maybe it won't be a pill after all.
If something forces you to want to do something, are you really doing it?
How disappointed would you be? You're driving to Wendy's thinking about the Baconator, and then all of a sudden Neuralink takes over. You leave the drive-thru with a salad.
But the salads are just as unhealthy.
Because of the seed oils?
Because of the high caloric content. That would be pretty disappointing. But we're probably not going to have those pills anytime soon. Whether you're red pilled or blue pilled or black pilled or I forget what the other colors of pills are. those pills are, there's no replacement for consistency. So people can see when we've talked about our 75 hard years instead of 75 or 75 medium years. Instead of
medium rare years.
Yeah.
Something like that.
You don't want to have them be too difficult, and ideally not days, but years. But yet all that to say, consistency is key with those lifestyle interventions.